Who are the sharks? They are self-made college students worth not that much, interested in learning about human sexuality. Let's meet our sharks. Nicole is an allied health major who is interested in trauma medicine. Ariana is an allied health major who wants to focus on pediatric nursing. Although their net worth isn't all that impressive, they are interested and passionate about sexual education research. Howdy Sharks, my name is Allison and I'm here with my good friend and health advocate, Ashley, and we're here to give you more information on an implant birth control method called Nexplanon. So when you're choosing a birth control method, there are a lot of factors to consider, such as your health, the possibility of wanting children in the future, sex habits, number of sexual partners, and your access to health care.
Nexplanon is a very small, thin rod. It's about the size of a matchstick, and it goes under your upper arm by a doctor. It releases progestin to prevent pregnancy as it thickens the mucus in your cervix to stop ovulation. So Allie has had the implant since April and she absolutely loves it.
So that's completely true. I have had the implant since April and I do actually love it. And I've been completely satisfied with this birth control method, and the implant is effective, requires no maintenance, and it's cost effective because most insurances actually cover it. So it's a great, reliable method of birth control that lasts 3 to 5 years.
How effective is the implant? I've heard that it's one of the most effective birth control methods.
Yeah, so that's a great question. The Nexplanon implant is 99% effective, so with less than 1 pregnancy per 100 women each year. It completely removes human error, so like the days of forgetting your pill pack are just completely gone.
What are the benefits of getting the implant?
So Nexplanon allows me and other women that have the implant to not have to hassle with taking your pill every day or having a pill pack or carrying it in your purse. So the implant birth control is actually extremely effective, so I don't have to worry about any unplanned pregnancies.
Right, and so also it provides continuous contraception. So regardless of one's memory or schedule, it's so easy like to forget to take a pill or forget to run to the pharmacy to get a prescription filled, and just the implant completely eliminates all of those issues.
And the implant can also be removed at any time and allow pregnancy to occur shortly after removing it. So whenever the time is right, you can go ahead and not have to worry about doing anything other than going to the doctor.
What are the disadvantages of the implant? So these implants don't prevent STDs. Some people also experience irregular bleeding in the first 6 to 12 months, but these symptoms usually go away after your body adjusts to the implant.
How can I get the implant?
So it's super simple. Like we mentioned, talking to your doctor is like the most important aspect of this whole process. Once you and your doctor determine that it's a good fit for you, it can be inserted in with just a simple doctor's appointment. But things to consider are your sexual health, practices, and your other health, like pre-existing health conditions. And so you'll be given a local anesthesia into your upper arm, and it'll be placed in with a special needle, and it only takes minutes.
What does the public think of the implant?
So we actually surveyed individuals on a college campus and asked them basic background information such as age and gender, just to know a little bit more about them. And then we got more specific, asking about their preferred birth control methods and why they chose that particular method. And specific for our topic, we with Nexplanon, we asked if they had heard about implant birth control and figured out how likely they're willing to consider using implants as their primary form in the future.
And so we got over 160 responses and learned that 37.4% of our study used oral contraception, whereas only 10% used the implant methods like Nexplanon. But the remaining participants used other methods like there are various shots and that sort of thing, or no birth control at all. We also had a free response question because we wanted to judge how people kind of felt about it on their own terms and their own words. And we got a lot of comments about religion impacting birth control. In addition, people were content with their current one and felt no need to switch over.
So you mentioned that an incision needs to be made on your upper arm. So how safe is the implant?
So the implant is safe for most people, but like all medical procedures, there's some risks and side effects involved. So it's just best to just have a conversation with your doctor and see if it's actually good for you.
So what happens when the implant is removed?
So as mentioned, the implant works for 3 to 5 years, and you can take it out at any point along the process. It is possible to get pregnant right after the implant is removed, and some people will experience tenderness on their arm and a little bit of swelling, but that's all completely expected. But as always, if there's anything that kind of seems out of the normal or is causing great discomfort, talk to your doctor.
This pitch really showed me how convenient and effective this method can be. I'm in.
Listen guys, this implant is a great birth control method to talk to your doctor about. Y'all made it clear it's effective and requires basically no maintenance for years, so I'm totally in.
This project allowed me to learn more about the birth control method that I currently use, because I kind of went into it without really knowing much, and so being able to actually dive in and research about it helped me a lot. But it also helped me realize that I will be potentially talking to future patients about birth control methods, and if I only know that, oh, the implant method exists, but nothing besides that, then I won't be able to better educate them. And I know that people have a lot of questions about things like this, so it's better that if we're informed as healthcare professionals. And I also liked that we could survey the general population of Texas A&M, because people would normally not talk to you if you were like, oh, do you want to get this implant in your arm for birth control? No, we actually got to get their opinions and got to see how they thought, and actually more people knew more about Nexplanon than I thought they did. So I'm really glad we got to do this, because I got to learn more about the implant method and how other people view it.
The most eye-opening part of this project for me was the survey section. We got to see a lot of really strong opinions, whether that be just personal beliefs, religion, or politics. It shows the sensitivity to the subject. It's something that we need to be, as health educators, we need to be well-rounded in, so we know how to answer questions without bias, without any misconceptions. In our survey section, we did see a lot of misconceptions. Some people said some things that just didn't make any sense, or just weren't backed by any evidence at all. So it's nice that we were able to put correct information out into the community with our report. So yeah, as a future nurse, I think it's important that I consider these opinions and respect them, and have the knowledge to let people know about the implant, because it's great.
This project has just made me more aware of this form of contraceptive. I've never even been aware that you can get an implant right here on your upper arm. And I think it's really cool being able to learn how effective it is and how convenient it is. And as a future health professional, I will definitely make sure that my patients are aware of this form whenever they come in, that there's more than just the typical oral contraceptives that people tend to use. Especially kids that are college age, high schoolers, that tend to forget to take their pill every single day at the same time. By not doing so, it can decrease how effective the pill is. But this way, with an implant, they don't have to worry about taking anything at certain times. They just get it inserted, and it's good for 3 to 5 years. So I thought that was a very cool thing about doing this project.
So this research project has allowed me an insight to public opinion that I otherwise would not get. Because I have, an established university backing me with this class, I kind of got that level of professionalism that me as myself as an individual could never really get. So the responses to our survey were incredibly diverse. We had people talking about their different religious beliefs, their political views, and why they choose one method over the other. And I think that kind of establishes the importance of having diversity in the healthcare setting, and with healthcare educators and healthcare providers that kind of accept that diversity within people. So throughout this whole semester, I've gained a bunch of knowledge, and I'll be able to better discuss the birth control methods with confidence.
Whiskers. Yes, actually, it looks like my mom's. Bum 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 bum. I can't do it. We can't do this.
Methods of contraception available, including Nexplanon and